આપણે થોડી કેળાની વેફર કેવું લઈ આવીશું. So, welcome to this PGNAR and good evening to all. This now we have started calling it as a digital seminar organized by Dermatologists Consortium of India. So, Dermatologist Consortium is not a legal body or anything else, but we are all friends and groups of here. Welcome once again to everyone. And I welcome this evening Dr. C.R. Srinivas with our typical Rajasthani turban. And we offer you a Rajasthani turban, my dear Srinivas. You look and a virtual bouquet also. I hope you can smell the. Can you smell?
Yeah.
Oh,
There is
that
a
means you are corona.
butterfly is trying to sit on it.
You are corona free. That means that's it. So if you can smell this, then you are then you. And I'll request Dr. U.S. Agarwal to kindly introduce Dr. C.R. Srinivas. Formal introduction.
Good evening, sir.
Yes, we can listen. Yes, your voice is not coming.
I think there is some issue at his end, sir, in the net connectivity.
Well, Lalit, can you please?
Yeah, I'll start. So, good evening, everyone, and it's our privilege to have amongst us a legend in dermatology, Dr. C.R. Srinivas, who is MD and FRCP from Glasgow. He has been a professor in the Department of Dermatology. He is currently professor in the Department of Dermatology, KIMS at Bhubaneswar. He had been heading several departments across the country, including Coimbatore, Manipal. He has a membership for several international organizations, and he is a very well-known figure, not only in India, but across the whole world. And it's really our privilege to have you, sir, here today. And
Thank you.
today he'll be talking on the itchy scalp. So, screen is all yours, sir. Now, please start.
Thank you.
So before that, we will have a formal this thing. Good time pass. And I'll request Dr. US to kindly present him a bouquet, a virtual felicitation. Since can you listen, Dr. US?
मेरी आवाज आ रही है क्या?
हाँ अब आई है, वो बीच में चली गई थी. So please present him a virtual felicitation and certificate of appreciation. Dr. US.
Please, sir. I welcome, sir, Dr. C.R. Srinivas, sir, and I present a bouquet to you.
Thank you very much.
A trophy and a certificate which has been nicely prepared by Dr. Dinesh Mathur, sir. Please accept it.
Thank you, thank you, thank you very much. Much honored.
Thank
It's
you
a
very
pleasure
much.
to be.
And at the end of your talk, we will be having a quiz. So let's say everyone participate in that. And after that, we will start discussion after a break of 10 minutes silence. Right.
Whatever is not an issue.
So now I stop sharing over here and request Dr. C.R. Srinivas to kindly take over the session. And there are almost more than 60 people are here on the board. And I'll welcome Dr. Niranjan Nagpur, sir.
Right.
Yes.
Thank you very much. I don't think there is an individual or any dermatologist who has not been consulted by a patient with itching of scalp. And there is not a dermatologist who has not scratched his scalp. So that tells you as to how huge and wide this problem is. And once the patient sits in front of you, he makes you want to scratch. Such is the emotion this thing. They describe it in various ways. They don't always tell it as itching. Some will tell it as burning. Some will tell as pricking. Some will tell it as crawling. Some will tell as something is happening, and you will have to interpret their language as to what they're conveying. At the end of it, they are conveying what is known as an altered sensation over the scalp. When I was in school, we had a master by name Sharma, a humorous chap. And then he was a maths teacher. And most of us, when he would ask a question, we wouldn't answer. And then we would start scratching. And then he would come and say, if scratching is going to help you find the answer, let me do it for you. And he would scratch. And all the others would laugh in the class. But then, is there any science behind it? Yes, scratching of the head is a behavioral response. It activates the prefrontal complex, orbitofrontal complex, and decision making and expectation. It regulates the planning behavior associated with sensitivity to reward and punishment. So scratching does help. Of course, there has to be something you know for it to come out. Scratching is not going to give you the answer. But if you do know answer, maybe that trigger will help you come up with the answer. And this recognition of the each sensation, these are the things which I'm just showing for the regular thing, which we don't need to remember. It is there in the cingulate, gyrus, insular context. So these are the various anatomical things. Scalp is a very different structure from the other parts of the skin, as is every part is very important. Scalp innervation is different. It has free nerve endings. It has lanceolate, that is fine nerve endings, which is there around the hair follicles, which we can detect during the movement. I don't know how many of you still remember that when we are testing for Hansen, we should be careful that we don't trigger off this lanceolate nerve ending that is there around the hair follicle, because patient will recognize the sensation. And there are two ways to avoid that. One is to shave off the area, and other is to apply the water. Water is not a better area because it anesthetizes. So shaving and testing the sensation is something which we are taught right at the beginning. That is because of the sensation being transmitted from the hair follicle. And these are the Merkel and Ruffini are the pressure organs that is there in the scalp. And this is the innervation of the scalp: ophthalmic division, maxillary division, mandibular division, second cranial nerve, third cranial nerves are the ones that ensures that there is a nerve supply to the scalp. And those are the various nerves you can see. Then, of course, what are the commonest cause of infection, itching? Is again pediculosis, as we have to remember. And the commonest cause of lymphadenopathy in children, especially in the occipital region, is pediculosis. Then, of course, the other causes could be fungal like Picrosporum, dermatophytes, and bacterial aerobic and anaerobic infections can also cause itching. Folliculitis of the scalp is again a very, very difficult condition to this thing. This patient will keep on coming to us, and then eventually they will get all right. That is what we tell them. That eventually it will go off. Till that time, let me try one drug after other. Maybe something will work for you. But many of these persons will have itching, burning, pain on the scalp, and their mind sort of get focused in that area. Not only their mind, the parents also start worrying about this condition. Maybe we could talk about how to manage this. It's a difficult thing during the discussion. This itching on the scalp can be caused by exogenous agents such as oil, gels, shampoos, which can be drying, can be irritating, various cosmetics used, medicaments. People go on applying various medicines on the scalp that also can cause allergic sensitivity, can cause irritation. And you must always know that even a non-irritant substance on a sensitive skin becomes an irritant. Allergic contact dermatitis, once it occurs, anything, even water can become an irritant. Temperature, you know well that in the head, because of the hair, the temperature can go up, can go down. And of course, because we take bath over there is a lot of humidity on the scalp when we take a head bath. So the humidity is high over there, heat is high over there. All these factors, none of these factors can be act singly. They will act together in combination to cause the itch. Dry scalp is one of the very common cause. Anywhere in the body, dryness is going to
It's
cause
dried
itching.
up. It's not paining, but I think it's still not gone.
So dry scalp can be in that frequent hair washing with hot water and aggressive shampooing can cause the drying. We tell people not to use hot water on the scalp because that can cause more drying. Holding the hair drier clothes, cold windy weather, all this can cause dryness of the scalp, which can result in itching. Then, of course, not washing also can cause itching. So, especially people, ladies, some of the ladies with long hair, they take bath once a week and all that. In them, the various scales mount over there, the Pityrospora mounts over there, the bacteria mounts over there, and that also can cause. And add to it the humidity, oil. They will above it, over and above it, they will add oil also. All this together can cause itching. So, too frequent washing, not washing, either two. So, what you need is a balanced approach. Then skin disease can cause. This is one thing many people tend to forget. Dermographism. Dermographism is a very common problem. And everyone has as I say, everyone has got atopic dermatitis. Who does not sneeze? Likewise, everyone has got dermographism. It might be very, very mild, that is not clinically visible, or it might be severe. But the same mild one, when it is there on the scalp and you scratch, the dermographism will itch more and you scratch more. And because of dermographism, you will get itching. So this, I believe, with urticaria, dermographism. Even in the absence of urticaria, dermographism is an important thing, and this dermographism will respond well to antihistamines. Then, of course, lichen planus, you well know that follicular. We used to say that follicular lichen planus on the scalp does not itch, whereas the only itchy condition in syphilis is the follicular syphilis that occurs on the scalp. However, follicular lichen planus, there is itching, likewise discoid. Psoriasis, now we know that initially when we were students, we were told that we thought that psoriasis does not itch, but itching is a major complaint in case of psoriasis. Darius, PRP. But this is last one is scleroderma is one thing, post-herpetic neuralgia. I will stress upon this because some of these can be missed. Post-herpetic neuralgia is most likely there is itching along the dermatome, which persists over there. Along with the pain, itching also can persist in many cases following the healing of herpes zoster. This could be because in some persons there is a loss of sensation, and because of loss of sensation, people go on scratching, excessive scratching, and that could be because we know that in herpes zoster, though in some people there can be increased pain, in some persons there can be anesthesia in that area, and in those persons there can be itching, and this may respond to pregabalin. This is the one I am telling about. I should have published, I have not. But I have seen many cases of itching on the scalp where they will tell you that they are having itching, and you look, and some of them you will find that they have got vitiligo-like patches. Many of them have been on treatment for vitiligo from some places, but they will come to you for itching of the scalp. Look behind their ears, look at the bitemporal areas, you will find this salt and pepper. Do an investigation. There will be no other finding of scleroderma, but SCL70 and ANA will come positive in these cases. Not yet published, but I can vouch for this. So these are the various condition lice. One thing you may like to know that lice only occurs in people who are healthy. People who have got sick, once a person falls sick, the lice sort of deserts them. So when a person comes to you with much lice, I always believe that when a person comes with a disease, give them something to be happy about to the mother. You can tell them that your daughter is very healthy because she is not having any disease, so only lice is there. If she develops disease, the louse will go off. Then they will feel that their daughter is less lousy. Stress is a common cause of itching. We all know that when it is there. And also here again, the dermographism may play a role. When there is stress, we scratch the head. When we scratch the head, we induce dermographism, and that itself can take over and can continue the itching. Then endogenous factors, we all well know that seborrheic dermatitis, atopic dermatitis, scalp, they say is not much involved. But then many cases of atopic dermatitis, especially in children, we find that atopic dermatitis is a common cause for itching on the scalp. Then there is a sensitive skin syndrome. It is basically a thing which is a very therapeutically challenging. There is no itching elsewhere, no detectable lesion, and the person will have itching. This is a sensitive skin syndrome. This sensitive skin can be caused by any of the diseases which I have told, and the disease may go off and leave a sensitive skin. Alternatively, in the absence of any of those conditions, where we could call it as primary sensitive skin, and a person may have a sensitive skin on the scalp and they may be having itching. We all know that we use a lot of topical steroids, we use a lot of shampoos. All this can lead to sensitive skin on the scalp. What happens in most of these cases when a person comes to us with itching on the scalp? We sort of jump to a conclusion this person has got seborrheic dermatitis. And before we examine properly, before we ask too many questions, there is a tendency to treat this person as seborrheic dermatitis. This malassezia furfur, which is an important reason for the seborrheic dermatitis, is a dual thing. It has also got a protective effect. Whereas it can induce itching because the sebum is abnormal, it also reduces itching. And it is found mostly on the scalp. In normal condition, malassezia yeast significantly reduces the production of pro-inflammatory cytokines by the keratinocytes. And that is responsible for reduction of itching. So in the absence of this lipid layer, it can cause more amount of itching. So when a person comes to you, we just don't give an anti-dandruff shampoo, because an anti-dandruff shampoo can reduce the normal malassezia furfur if that is not the cause, if seborrheic dermatitis is not the cause, and your anti-dandruff shampoo is going to cause the itching. And this becomes much more important because we as dermatologists, we get plenty of anti-dandruff shampoos, and many of us will think, shampoo ko kharide, itna to mil raha, laga rahe. And this anti-dandruff shampoo is very, very itchy. Even when I have persons with dandruff, seborrheic dermatitis, I tell them to apply the anti-dandruff shampoo on the scalp for 7 minutes and then wash their hair off with the normal shampoo with the conditioner. The reason being, if you use an anti-dandruff shampoo for a normal hair, it causes far more drying, making the hair more difficult to comb, thereby increasing the static electricity, which can lead to damage and breakage of the hair. So be careful. If you are getting samples, give it away. Don't bring it home. Now, sensitive skin, as I told you, subjective complaint and various discomfort. These persons will not have any predictable or conditions. Sensitive skin, to go back to it, as I told you, can be caused by any of these things which I already listed, inclusive of deficiencies, which can also cause itching on the scalp, either by inducing sensitivity or by itself. Vitamin deficiencies can cause, alcoholism can cause, it can cause seborrheic dermatitis-like features, riboflavin deficiency it can cause, and all that can cause itching on the scalp. It can also cause itching over the crural and scrotal area. When a person comes to you with itching on the scrotal area, do ask them whether history of alcoholism, you may strike gold, if not alcohol, in some people. Metabolic conditions can definitely cause itching. Some, by causing dryness, can cause itching. Scribner observed several patients whose primary complaint of pruritus confined to the scalp was caused by unsuspected diabetes. So when a person comes to you, ask, do you have diabetes on the itchy skin? And if they tell you they have diabetes, that could be the cause for itching, in which case it is because of the nerve damage of the diabetes that is causing the itching, and no amount of topical steroid or something is going to make it go. You will have to address the diabetes with drugs that address the nerve endings like that, pregabalin or nortriptyline or some such drugs you will have to use in them. Otherwise, the itching won't go off. And even if your diabetes is controlled, the itching will persist. In some, to date, about 3 to 4 patients, I have detected diabetes when they have come to me with itching on the scalp. But controlling in some persons, especially in the early stage, when they come to you, you control diabetes, itching can be relieved. In an established case, controlling of diabetes does not relieve the itching. Cosmetics, as I told you, can cause irritation, can cause allergy, can cause dryness. All these can cause occlusion, can cause heat, can induce sweating. All these factors can attract dust and keep it. The oil can attract dust over there, and that can induce itching. And of course, hair dye. Let us look into the hair dye. I will get into it in more detail. So there are various active ingredients in the what we use on the topicals, which is used be shampoos, lotions, and all. They have got multiple ingredients. Plants are there, preservatives are there, antiseptics are there, foaming agents are there. All these can cause both irritant dermatitis, allergic dermatitis, and a combination of both. And then medicaments such as tar, minoxidil can definitely induce itching, can cause dryness in some people, but it can also cause allergy. So if a person comes to you with minoxidil, you first try 5% when you are giving the try 2%. If they still have itching, then suspect that they have got allergy and then do a patch test, rule it out. If of course they do have allergy, then you cannot use minoxidil for them. And doing patch test with minoxidil is very easy. Take a fin chamber, put a drop of, keep all the various minoxidil on the with you with 2%, 5%, maybe 7.5% in water or whatever preparations you have, foamy preparation. Try. If a person is allergic to one, not to another, you could use that. Topical antibiotics, we well know, can cause sensitization. We did a study on persons with itching scalp to find out the cosmetics and allergens causing the dermatitis. This was done by one of my PG students, Dr. Anita. And we had this inclusion criteria of itching on the scalp. Exclusion criteria were this. And we did the patch test with the chemotechnic diagnostic series, the standard series, and the patient's own products. Of course, shampoo and all, when we used, we diluted it 1 in 10 and then tested with that. And interpreted as per the ICDRG recommendation. And this is the patient information sheet which we had. And this is what we got, that of the 20 persons whom we finally were able to test, because patient, there were dropouts and all, 7 had dermatitis, 6 had single positivity, like itching was there. That means so many did not have dermatitis. They had come to us with itching on the scalp. Single positivity, 2 positivity, more than 2 positivity, and negative. So there can be multiple positivity to various preparation, and these are the chemicals to which they tested positive. PPD, you know, it because of hair dye, the gallate mixes, then bromides, then fragrances. Thiomerazole, of course, is a very difficult thing. It may or may not be related to that. Preservatives are the various things which are present in various topicals, which can cause allergic contact dermatitis and tested positive in our patient. So what you do is you check the product which a person is using, see if you are able to correlate with that, and then try to stop that and see if you are able to alleviate the problem. Now let me take about hair dye. Hair dye is a very interesting thing as to how it works. So let me take this analogy and try to tell you the story. I don't know how many of you, of course, we all know the Sean Connery from Scotland, our great James Bond, the original James Bond is no more. But he has acted in many other good movies. One of the great movies of his was The Great Train Robbery. In The Great Train Robbery, where the gold bullion is being shifted by the train, which is totally guarded, he manages to steal from that. He finds a boy who is able to wriggle in through the window. He has a key man who can go and open the key and take out the money. And for distraction, he had a lady, of course. And then this was the person, key man, who could jump through the window. And this is the train from which he is jumping from the rooftop. And in the end, after the court, after they designate him guilty, he runs off. So here, entry is important. After making the entry, the acceleration, the catalytic action is important. After the catalytic action, the removal, oxidant action is important. And after the oxidant action is done, the uh, breaking of the sulfur bonds or the breaking of the key, that is the sulfur bond, the breaking of the lock is important, where the sulfur bonds are broken. And after the sulfur bonds are broken, the addition of the dye is important, that is stealing of the money or whatever, stealing the money is important. Finally, after coming out, the closing of the aperture or the lock so that the people do not know how the theft occurred is important. Hair dye does exactly this. Ammonia is like the thief who can go in through the window, can go in and open this thing for others to can open the door for others to enter. It also acts as a catalyst. The ammonia is there. It acts as a catalyst for the permanent hair dye to come together with peroxide. Peroxide and the dye has to come together to form the dye, which is going to, otherwise it is colorless. You know that once these two come, it becomes colorless, and then peroxide is the developer or the oxidizing agent. Then this peroxide removes the existing color over there. That means it takes away whatever color is there. And then peroxide breaks the chemical bond, that it breaks the key and the chemical bond, releasing the sulfur, which is why when we use the peroxide, we get the sulfur odor. And then as the melanin is decolorized, then the new permanent color is bonded into that. That means the cover up is done over there to the hair cortex. And finally, after escaping, the conditioner repairs the cuticle. The damage that was done to get in by the ammonia is done by the conditioners, where it is sealed once again. So this is how the hair dye or the PPD works in a patient, in a normal person. So you can see the sulfur bonds over there, which is broken to give rise to this. And when you do patch testing, you may get PPD positive in many cases as well as others. So these are some of the patch test results which we got. So that is the theory. Now I'm going to a little more about the theory about the itching, because I always believe that theory tends to put people to sleep. So I tell the other part of it important. So let us spend a little time on understanding about itching. And these are rather complicated. I have not gone too deep. I don't have the time or the inclination. I'll give you the gist of it. Intensity theory is a theory wherein the weak activation of the pain conducting C fibers is the one that is responsible. It's the old one. Now the present theory, the distinct sensation by a separate pathway, is the one which we now believe. In urticaria, we know that itching is caused by histamine, and when it occurs in the upper portion, we get a wheal and flare. When it occurs in the lower portion, we don't get so much itching, we get angioedema and pain, and the mediator is histamine. These cells, they talk to the sensory nerve endings. They communicate with each other. It is not that it occurs. These cells communicate with each other. The various receptors are there. But to us, the most important are the C receptors. We know that some are myelinated, some are unmyelinated. In myelinated one, the sensation goes very fast. In the unmyelinated one, it goes very slow. Of the C which is responsible for burning, there are certain type of C fibers which are unmyelinated, which are slow conducting and cover a large area. So these C fibers are the one which is responsible for the sensitive skins on the face or the scalp, on the scrotum. This is the one that conducts normally, not for the effect of this, or when it gets affected, we get the sensitive skin. Which is why these C fibers get activated. So you come out from some place and you feel very tired. You splash water on your face and immediately you feel fresh. And even if you don't, with a hand, you just rub your face, you feel you're freshened. You activate these C fibers, which gives you the freshness. As I told you, the C fibers talk with the various cells to produce the various changes which we perceive. And then, of course, we know the histamine, the various types of histamine is there. Again, this is a lot of theory. But of interest is another transient receptor potential TRP family of receptors. These receptors are the ones. Now, let me try to tell you. You feel very itchy. And when you feel very itchy and very hot, you go into an air conditioned room, immediately the itching decreases. And this is because the cold stimulates certain fibers. And when those fibers are stimulated at between 8 to 28 degrees, itching decreases. So when these receptors are stimulated, itching also decreases, which is why we use menthol to activate these receptors. It activates at a lower temperature. Capsaicin we know also can activate, but at a much higher temperature. Likewise, when we apply cold on the skin, you all well know that if you apply spirit on the skin, then you give the injection, it is one of the anesthetists, and then cold is an anesthesia, we spray it for various reasons. That is because of the activation of these receptors. So which is why we use, give me a minute, I'll just put off the phone and come. I'm in a talk now. Please follow me.
Well, what happened? Dr. Srinivas?
Sorry, I forgot to turn on that don't disturb thing. So this is what we use.
Oh,
We
no,
can
no.
see the various things which can reduce the sensation. This is why when we go to the temple, they give you this teetham. Of course, we have different teetham which unfortunately we are not able to share today. But this teetham, when we apply it, it has got menthol on it, which is why we apply it on the face, and it has got the cooling effect. Cooling will reduce the itching. Then, of course, heat can increase the itching, as has been reported by our one and only Professor Sugadan, wherein because of the heat, there is, as I told you, multiple factors. Oil is there. They use various abrasives while taking bath. Then there is oil, and then there is a humid area. Water is there. So all this together gives an atmosphere known as mudi. Mudi means hair. Sudu means heat, and that heat can cause the itching, which gives rise to LP-like lesions over the nape of neck, and reported by Professor Sugadan. My Chittappa means my father's brother, once told me, I am getting itching over here in the back. What shall I do? I looked, his skin was normal. I told him, go buy a scale. He said, what for? Take a scale, a ruler, and scratch your back. So scratching is by far the best way to reduce itching, and quite often many an itch goes off. And there is a lot of different type of scratches you can see which are available. So you can choose one of that. And then there is a book by James A. Michener. James A. Michener is a person who writes a sort of semi-historical, he sort of takes the event that occurred ages ago, 100, 200 years ago, and sort of weaves that into a story over what happened. For example, if the archaeologists go on digging, from the bottom he will start and then come up. So in a tell in Israel where they dug, right at the bottom, the Jews were using these scratches. So from that time itself, the scratches were available. So scratching itch is relieved by central mediation. So that is how we use also TENS for this. It closes the gate by activation of the suppressive neurons on gelatinosa. It may also damage the sensory nerve endings and repair occupying several minutes. So it takes time for the repair, and during that time we are relieved of the itching. So what are the various therapeutic options? How do you manage this itching? Well, it will depend on the cause. Get rid of the lice, get rid of the fungal infection. If there is diabetes or something, control that. If there is thyroid, supplement the thyroid. If it is too much of thinking, stop thinking. Can you stop thinking? Yes, you can. You can go in for meditation. Meditation is one of the wonderful way wherein they teach you how not to think, how to keep a busy mind quiet. And if you can make a busy mind quiet, if you can prevent the mind thoughts jumping and like a busy traffic zone, you'll find that itching becomes less. So meditation will be a good idea, and there are certain very good apps which a person can use, and I do advise them. Hygiene becomes important, cleaning is important. Oil is a very funny thing. So you hear the history. If a person says, when I apply oil, I get more itching, then you tell them, don't apply. Then they say, if I don't apply, I get itching. I tell them, apply. So you can get the answer as to what they should do from themselves. Then topical steroids, of course, we have to use them. Cleansing soap. I use menthol with coconut oil. 1% menthol in 1% menthol in coconut oil, which is a wonderful thing to reduce itching and works in many cases. And topical tacrolimus also can be used. Tacrolimus has been reported to have it is not, you don't require, unlike steroids which has got anti-inflammatory, without that it can reduce the itching. So I'm coming to the end of my talk. Happiness is having a scratch for every itch. Of course, one way is you can put on something on your head and prevent your hand from reaching, or the lovely sort of thing which Dinesh put on my head. Even if I have itching, I cannot scratch unless I remove it. Or of course, there can be certain permanent solutions for itching, which cannot be really recommended. And who does not itch? As I told you, it affects everybody. And if a sister is around, they will boss you, and you have no choice. Or maybe even a wife, you have no choice but to scratch. So thank you very much for giving me this opportunity to talk.
Thank you very much, Srinivas. It was really very nice. And this time I will just take 10 minutes. I'll put a small GK quiz over here. You have to just go to your chat box, see that if you can find out the answer, one correct answer for 10 questions, 10 different questions with four multiple choice question answer.
I
And
will take leave for a few minutes and join after 2-3 minutes. Okay.
sure.
Yeah.
So if you can see in your chat box, there is a link which can open your this thing. So I've started the quiz, and I have compulsorily muted everyone so that nobody can speak. And after 10 minutes, I will open it. And after that, we will have the question, answer, and comments. Dr. Lalit, be prepared for that.
Yes, sir.
What's the problem?
Gordon.
I think those who are attending the quiz questions, they can continue and we can start the discussion. Dr. Lalit, can you see the chat box and do the comments over that? One will have to unmute themselves because I compulsorily muted all. So please
Yes, sir.
unmute yourself and then
Yes,
participate.
sir.
Please.
So it has been a wonderful talk, sir, by you as always, and many people are appreciative of your talk. Dr. Khare, Dr. Jyoti, Dr. Soumya Mathew, and many others. There have been a few questions in the box that I can see. Somebody wants to know about the management of chronic folliculitis, which is a very distracting and difficult problem to treat. So, how do you personally tackle with these problems of chronic folliculitis and recurrent folliculitis of scalp?
Yeah, recurrent folliculitis. I will take 3 to 4 minutes to answer this question because
Yes,
it's a
sir.
little
Sure.
complicated.
Please.
So it cannot be a very short answer.
Right, sir.
First, we will have to.
I will also contribute in that. Right.
Yes,
Sure.
sir.
You want to contribute before me or after me?
After you.
Okay, fine. So this is a difficult condition. You tell them the person that this is going to be there for the name of it is chronic. Explain the name of meaning of the word chronic to them, and after that you take for treatment and tell them that to date you have not seen a case which has not become well, which also is the truth. But tell them that there will be a lot of frustrating time before it gets well. Then the second thing is uh, you tell them that different drugs will work in different people because one drug may not work. So I will be trying one drug after another drug. So that helps you buy a lot of time So that if a person, one drug doesn't work, and if it comes back, then so initially itself you buy a lot of time for the management of this condition. The next thing you can do is you can treat it as the chronic furunculosis, wherein we give rifampicin with clindamycin or cefalexin, and then application of the topical over the vestibule of the nose, interdigital area, beneath the nail, and then over the scalp also where the lesions are there, and the perianal area. Explain to them that the oral antibiotic will reach only those areas where the blood supply is there, and those areas where blood supply is not there and is still moist, the bacteria is likely to stay over there. Thus, after 14 days, the bacteria may go off from your head, but may be there in your nose because there is no blood supply over there. So if you touch that area and once again you touch your head, you are likely to get. So continue the topical beyond the stage. Then you tell them that as and when treatment is going on, you will find improvement. Whenever a single follicle occurs, in case of men, borrow the sister's eyebrow plucking this thing, pluck away that hair, remove the pus from that area, cleanse, and then apply the antibiotic. So that whenever new lesion, this is true for chronic folliculitis of the leg, it is true for the chronic folliculitis of the face. Pluck that hair because it will come out very easily. It is like folliculitis which occurs, psychosis which occurs over here. It will come out very easily. You can wipe that and then apply the topical antibiotic. As you go, the various drugs you can try. One isotretinoin, you can try colchicine, you can try dapsone, you can try, but be very careful about what you do. But as I told you, over a period of time, either the patient goes away or the disease goes away.
Thank you, sir. Dr. Mathur, you wanted to add something,
Yes,
sir?
yes, but Dr. Srinivas has not left anything to be added to that. The only thing is, I would like to add that I use different topical antibiotics for the using this thing, and at least minimum mupirocin has to. I ask them to apply for at least minimum 6 months to a year. Of course, they do not apply all the orifices like this nose and ear and the anal area, but it works. This rifampicin works very well. So everything has been covered by him. Thank you very much.
Dr. Lalit,
You
can
want
I ask
to
a
take care
question?
of colonization? Yes.
Dr. Lalit,
Nagpur,
Yes,
yeah, Dr. Srinivas,
Yes, sir.
if a normal person, if a person comes to your clinic for any problem, if he asks you what shampoo I should use, one second thing, whether I should take the head bath every day or not.
Yeah. So head bath every day, sir, we tell them that depending on your work. If you're working in a very dirty place wherein you're exposed to a lot of dirt, then you can take head bath every day, or else twice is enough, is what I try to tell. But then there are certain people who take head bath every day. I tell them you don't have to use shampoo every day. Just you can take a bath, but don't have to shampoo every day. And then what shampoo to use? I tell them any commercial shampoo with a conditioner or a shampoo followed by a conditioner is a good idea, and you don't have to apply oil after that.
The other question is, you said about adding menthol to the coconut oil. How do you do that?
Yeah, you take 1 gram of menthol. You can take one small piece of menthol, and then you can dissolve it by either liquid paraffin or warm coconut oil, and then add it to that. Alternatively, it is more soluble in acetone, and then after it is soluble in acetone, you can add it to that. Either of the two things you can do. But one, it is partially soluble in this thing. The whole thing will not dissolve, partially soluble.
It's not available ready-made, right?
how
आप कैम्फर खरीद लो ना, जो
Oh,
दिया के लिए जलाते हैं ना, वो काफी है.
you can ask any of these dispensing chemists, because normally I get
have.
one everywhere in Rajasthan, in Jaipur we have got a dispensing chemist. So I
And it
right
बहुत easily available है, sir.
Oh, yes.
All these chemical
And
people, they have menthol. It
otherwise
is available as fine powder. Then in South India, we have what is known as the Pachakalpuram. Pachakalpuram is something like camphor, which is dissolved in water and used on the head. That also works very well.
Thank you, sir. Dr. Mohit wants to ask, sir, in place of dye, can any herbal product or Kali Mehndi be recommended if the patient is having contact dermatitis to dye along with long-standing scalp pruritus? So he wants to ask about alternative to the dyes.
काली मेहंदी के राज के पीछे डाई है. अगर उसमें डाई नहीं जाएगा तो बाल काला नहीं होगा.
नहीं होएगा. That's
Raj
good.
behind Kali Mehendi, the secret behind is addition of dye. So what can you use now which can be used instead of that? I am doing a study now and also it is available in the market, so it is not a great thing. You can apply henna, which is available, pure henna. You should never take henna from any person, any powder, because especially if it is meant for the hair, they will mix it with dye.
Yes.
Pure henna from the plant. Even henna stored for a long time loses its ability to stain the hair. So you take that henna, make it as a paste, head will become orange. From the internet, go to Amazon, buy indigo powder. Make a paste of the indigo powder and apply the indigo powder. So one day henna, wash it off, next day indigo powder. Do this every week once. Then over a period of time, your hair will have a darkish color.
That's
There
a
was
good.
a product available called Vegetol from
That
some
is-
company from Lucknow.
I know it used to be available, it is not available, and it is supply was very erratic.
Yeah, that's right.
But this is very easy, sir. Henna खरीद लो और henna उखाड़ के लाओ, indigo खरीद लो, because you cannot get indigo otherwise.
I'm sure.
Then do all scaly scalp need anti-dandruff shampoo in routine? Somebody asks.
No, you should not. You are going to worsen it.
I think you answered that in your talk.
Yeah, you are going to worsen it.
True.
You should be very careful. Anti-dandruff shampoo can aggravate itching of the scalp by enhancing the dryness, because it is meant to remove the lipid layer. So if you remove the lipid layer, you're going to aggravate. So even when you're causing dandruff for this thing, tell them to use it, then stop it, and then use normal shampoo. And if they have dandruff once again, let them use it, and then go back to normal shampoo. It should not be uninterrupted. You should not use anti-dandruff shampoo to prevent recurrence of itching on the scalp.
Because I vaguely remember when Dr. Pastricha gave a talk on body wash or head wash and all. He used to mention that you can, like how you use the soap or anything for the body, you can use the shampoo regularly every day to the scalp also. There's no need that you should worry about. You have to clean, like how you're cleaning the body, you should clean the scalp also with the shampoo.
Yeah, but soap is drying, sir.
Regular shampooing
Soap is drying,
really
shampoo is drying. So you will have to follow it with a moisturizer on the body, especially during winter. Likewise, in the hair, you will have to apply the conditioner.
Oh yes, conditioner is the best.
Very important question is people will ask you, can I use shikakai powder?
Yeah,
Can
correct.
I use this thing? So
Amla
to
shikakai.
them, the answer is there are two ways to clean an oily stain. You take this glass plate, and if there is an oily stain, I can clean it with soap. I can clean it with sand.
Sorry?
Sand, balu, रेत.
Oh, right.
Wraith is a fantastic cleanser. लेकिन क्या करेगा? It is going to scratch the surface because it is going to clean by abrasion. Various powders, they clean basically by abrasion. Various degree of abrasion. Whereas shampoo and soap, they clean by breaking the surface tension. So उसका पकड़ चले जाता है, dust का पकड़ चले जाता है, पानी उसको धो के निकाल देता है, surface does not get altered. So this is the example you tell them, that using this powder is like using this is like using sand, whereas like using shampoo is cleansing it without hurting the surface.
So in that case, can fuller's earth be used? Multani mitti. People use multani mitti, a lot on the face and scalp. So does it have a role?
Don't know, sir. I really don't know, because
No,
nobody
Multani-
here
Multani
multani
is
mitti is
same-
not
same
very
again.
common.
Same sand
Okay.
effect and abrasive effect. Multani
Yeah,
is
but anything that is cleaning by abrasion is going to cause damage.
true.
What about Erita? Erita, many people use that Erita. I say it's a very nice cleansing agent, doesn't cause any problem.
Amla, Arita,
Sir, all these were fine before we had soap and shampoos.
Yeah,
This
correct.
also has got a soap-like effect. But apart from soap, it has got an abrasive effect.
So Erita is like a shikakai only, right?
Exactly, sir. It has some amount of soap in it. But अभी अच्छा साबुन मिलता है तो ये क्यों use करें?
Somebody wants to know about the scalp pain. Many patients complain about it. So please enlighten.
Scalp pain क्या होता है? Many diseases, They're very difficult. One is dysesthesia. Anywhere in the body you can get dysesthesia. You can get on the scalp also. You can get dysesthesia, and that has to be treated as dysesthesia elsewhere. But any disease or anything where your mind is focused on the scalp, बाल झड़ने से हो कि alopecia areata से हो कि irritant dermatitis से हो कि lichen planus pilaris से हो, all these things will in the end result with sensitive scalp. Could be because it has become truly sensitive, could be because various topicals have been used that has led to the sensitivity, but scalp becomes sensitive and that is the reason for the pain.
Dr. Rajesh Rajgopalan writes that I have noticed aggravation of itching after application of henna in patients with gray hair with dandruff. So any comments?
Yeah, thing is, it depends on how you, because very few people will apply henna as is. उसमें वो लोग बहुत पकाएंगे. They will add coffee powder. They will add some other oil, some other things to that. All that can irritate. Otherwise, pure henna in water, when you make it a paste at home, will rarely irritate. However, having said that, allergic contact dermatitis to henna has been reported, and even renal failure following allergic contact dermatitis to henna has been reported. But these are extremely rare.
Can we use conditioner on scalp hair or only on the hair shaft?
Yeah, people tell, patients ask me if I apply conditioner on the scalp, will it irritate? And I have looked the literature very carefully. It does not say that it is going to irritate. But how can you apply a conditioner on the hair without applying on the scalp? It is going to come in contact with the scalp. Conditioner is going to coat the hair.
Probably
What happens
females, they must be asking. Females.
Yeah. Another thing is, question is when to apply oil. Most people will apply oil at night time and next day they will take shampoo bath. You should tell them that it's a very wrong thing to do. And that oil dripping is one of the causes for acne also. So you should tell them, take bath and then apply few drops of oil, because if you apply oil and then take bath, water will not enter the hair. Hair is dead keratin. It has to absorb the water. Then only it is going to swell up and give the fullness. If you apply oil and then take bath, water is going to go away. It is not going to absorb. You are not going to get fullness. So take bath, then take few drops of oil and apply it on the hair.
It will act as a conditioner also, sir.
It is a conditioner. Oil is only a conditioner.
True.
Nothing more than a conditioner. If the scalp is dry, it is a moisturizer.
Sure.
Not a moisturizer, sorry, an emollient.
I think we are done with the questions in the chat box in case anybody wants to ask. I think that is all with the chat box questions.
Yes, and let me tell you that I put up some general GK questions, and
Yes, sir.
the following the Khyati Singla.
ऐसन बात है क्या? Wow. There should be some way by which we can detect this, and play it back to them. You can mute everybody.
That is what I am doing it, but since it was end of this thing, so I allowed. Anyway, so let me announce the results of the quiz, which I found very interesting. And Dr. Khyati Singla, Dr. Pragati, Dr. Jyoti Budwar, Dr. Tenjasu Dalal, Dr. Rajesh Rajgopalan, Dr. Jayanti Singh, Dr. Beena Rabadia, and Dr. Avina Jain. They all have scored 90 out of 100. So a big hand to all of them, and I'll give them a certificate of PGNAR this thing. So we just simply ask the telephone number, and if they have got WhatsApp on that, I can post the certificate tomorrow for that. So thank you very much for that. So I just thought that every time we should have something new and interesting for that. So thank you very much, Srinivas. It was really very nice, and everyone has loved it. And there were more than 110 people, those who attended this thing. And thank you very much. Any other comments or question? Dr. Niranjan Kapoor.
I
Thank
am
you.
happy, very happy that I could meet some of my very close friends, Satish Wadhwa,
Oh yes,
Dr. Nagpur,
Dr. Satish Wadhwa is also,
Dr. Datta.
Satish Wadhwa is a regular this thing. How are you? Thank you very much for coming. Dr. R.N.
उनको देखने,
Dr.
you look at him, दिल खुश हो जाता है.
अच्छा दुबई
When we see Srinivas, I think we are very happy. You are the most popular person in IEDL.
Sir, ऐसे कुछ नहीं sir.
All right. So thank you very much and good night to all.
Yes, thank you, Lalit.
Shall I end?
Thank you,
Bye.
sir.
And
Srinivas sir, thank you very much, sir. Thank you very, very much, sir. Thank you very much.
Thank you.
Srinivas sir, I always remember you.
See you.
Wonderful, wonderful presentation, sir. Thank you,
Yeah,
sir.
my
Bye.
pleasure. My honor, sir. My honor.
We are honored, sir. We are all honored, sir.
all right. Good night all.
Bye.
Good night. Good night.
Good night.
Right.